I think it's no surprise that people today are more interested in living a more natural lifestyle, and herbal remedies kind of fit into that picture. Typical scenario, Bill goes to the doctor. He's a little bit overweight. His blood pressure's up 10 points. His cholesterol's 15 points up. His joints are a little bit tight. And the doctor looks at him and says, "It's okay, you're perfectly normal." How does Bill feel? Does he feel like his money was worth paying to see the doctor? He feels not so good being told that he's just like everybody else. His blood pressure, cholesterol are up. He's not going to be very happy about it. And those sort of people, they often go and talk to somebody, particularly if it's a woman. They have a much more integrated system of being able to share with different things. Guys tend to be more loners, but people generally find out, well, I did this or I did that and it worked for me, okay? And so that encourages self-medication, and taking control of our health is very vital in today's marketplace. We don't want to give the well-being of our lives over to somebody else, do we? We have to take management. We have to know what our cholesterol is. We have to know what our blood sugar is. We have to know what all the, if you have something growing on your arm, you have to be managing it and looking out for it, and tell the doctor about it. Because if you leave it to them, they might miss it. So it's important for us. Another reason why people often go to using herbs is the difference in price. Here you have cholesterol reduction medication versus garlic, a sleep pill versus using valerian, and prostate medication versus sal palmetto. And you can see in all cases the price is considerably less. Now, I mentioned earlier about doctors and healthcare professionals should know what their patients are taking. And here's just 3 examples. Feverfew, which is taken for migraines, it can interact with a non-steroidal anti-inflammatory drug, and it can negate the effect of it. When you go for surgery in the United States, a common question is, are you taking garlic? Because if you're taking garlic, your blood clotting mechanism is going to be altered. So they want to know that. If you're on blood pressure medication, you're going to have increased bleeding and so forth. So it's important from this. Now, not all herbs are safe. Here are some examples. Now, I put this one here because it grows in our backyard in Michigan. It's called pokeweed or inkberry. In the southern part of the United States, you can eat the leaves for salad during springtime. Delicious. But when it comes to autumn, these berries can kill you. So one part of the plant may be good, another part of the plant may be not so good, different times of the year, fortunately. When I was at school, in grade school, I took a woodworking class, and my mother was very proud of me when I brought home the work that I'd done on the lathe, when I'd made a lamp stand and a bookshelf and some other things. And I always proudly put them in the corner away from where Mother was sitting. I didn't want her to look closely at them. Why was that? The closer you look, the more flaws you see. Exactly. So they look good. Oh, I'm proud of you, my son. You look so beautiful. Oh, thank you for making me this. Well, that's okay. Just stay back over there. You know. But you know, I want to tell you, with God's creation, the closer you look, the more magnificent the more awesome it becomes. These are high-powered electron microscope taken of various herbs. This is chamomile flower, and you see these little bags on the side. This is where the scent is, where the phytochemicals are located. Here you see peppermint, and again these sacs. When you cut the leaf, you cut through one of these sacs, and out goes all the terpenoid compound that makes the peppermint so nice. Okay, so this helps you understand when things are left lying around, the odor will disappear because this is like, it's like petrol. You know, you leave petrol with open can, you come back in a weekend. Well, the same with this, but this isn't that beautiful? It looks like something from fiction movie or something. It's incredible. And here is sage with all of these protrusions and everything taken with a very high-powered microscope. And again, you see the secretory gland there that contains the health-promoting properties. Oregano, similar. And here is ginger with this globule of oil in the center of the makeup of ginger. Such beautiful, exquisite design created by God. And these things that we think of just to make our food more tasty, they are magnificent. Just imagine these things when you're eating them, coming down, tickling your throat. They're not only magnificent to look at, but they also contain health-promoting properties. A lot of people use herbal teas for various reasons, and we shouldn't look upon them as curing everything. There are some herb teas like rooibos and some others which are very useful, but we should also be alert that sometimes some of these may have properties that are not good. We also want to buy them in standard boxes, not loose in a bin in the supermarket, because sometimes shop hands don't know what they're dealing with. We want to buy from safe companies, and many of these things have not been tested for pregnant women and small children, so we want to be careful in that respect. Now, I want to mention one herbal sweetening agent. This is all under the umbrella of artificial sweeteners. We're familiar with saccharin and NutraSweet and Splendor and so forth. But recently, onto the market in more detail has come stevia, or stevia, depending on which side of the Atlantic you live. And these are now used in drinks and in many beverages, and also are available in little packets. And people have asked, what is this? Well, this is an extract from a South American plant. It's a herb, and it has 300 times the sweetening power of sugar, no calories, and it has no bitter aftertaste, and it's heat stable, and it has negligible effect on blood glucose, and it's a very attractive substance for use with diabetics and people with metabolic syndrome. World Health Organization found no evidence that the sweet compounds in stevia, riboside and stevioside, have any cancer-causing activity. Some years ago there was some question about this, but in 2008 the FDA in the United States allowed it to be used as a food additive, and they have been through fairly rigorous testing. So if any of you are thinking about this, this is a non-caloric, safe sweetener. Okay, now what about digestive aids? There's a number that have been used. Ginger is very well known as an antiemetic. When we went on a boat cruise in Alaska one time, the captain offered us all ginger cookies. I thought, nice guy, gives us cookies. Why are they ginger? I was expecting a different answer than what I got. The captain said, "Don't you know, ginger will stop you from all over my ship. So I give you these so that I keep my ship clean." So even the captain knows this. And it's been reported to have equal potency to the commonly used medication Dramamine without the side effects, without feeling drowsy and feeling stupid. Okay, peppermint is another one that was pioneered by the British for irritable bowel syndrome. It's also used to help with gas problems. And I don't need to tell Europeans anything about chamomile. This is the favourite of all households. It's good for gastrointestinal spasms and problems there. Slippery elm is another one. It's made from ground up the bark of the elm tree, and it provides great soothing relief to an irritated GI. And then there's licorice, which has been shown to contain flavonoids, which provide protection against chronic duodenal ulcer. Okay, what about migraines? Feverfew is probably the most. You see the picture here. If the translators don't get the name right, at least the picture here shows you what it looks like. It grows about 25, 35 centimetres high, and it has been shown to effectively decrease the severity and the frequency, but not the duration of migraines. It contains various terpenoid compounds, we call them sesquiterpene lactones, and these inhibit the pro-inflammatory eicosanoids as well as the release of serotonin, which is involved with migraine formation. And then we have another interesting one, which is peppermint oil, which you can rub on the forehead and gets absorbed in, has an analgesic effect. Eucalyptus oil, nothing. Other oils, nothing. Peppermint oil somehow is unique and does help relieve tension headaches. And then those who have anxiety and irritability and nervousness, there are some mild tranquilizing herbs. And these are not in any way like Valium or some of the other potent drugs. These are very gentle. They're often put all together as a mixture. You often can buy valerian, hops, passion flower, lemon balm, and or lavender mixed together, and that seems to be just a little bit more effective. Valerian is used as a sleep aid and as a mild sedative for people who are anxious and who have sleep disorders and nervous excitement. It's been used for a long, long time. It goes all the way back to Hippocrates, who used valerian root. It's actually the root that contains these active compounds, valerianic acid, which is a sesquiterpenoid, and other compounds. We don't exactly know where the sedative properties come from, but there's scores of different compounds that are there. And as mentioned here, 30 studies involving over 5,200 participants have shown positive effect by using valerian without, and that's the key there, without having morning sleepiness, which is what people often have when they take a sleeping pill. Then staying also with the brain and its effects, we think of St. John's wort, which is a number of clinical trials have shown that it's useful, very safe and useful for mild to moderate forms of depression. And the compound which we know of is hypericin. Just as a little heads up, when you buy St. John's wort, you want to look and make sure that it tells you how much hypericin is there. If it doesn't tell you, put it back on the shelf, because you want to buy only from companies that tell you how much hypericin. That gives you a clue that the company is trying to maintain some measure of product quality, and they are guaranteeing sort of that their product has this compound in there. Otherwise, it could have nothing. And this is possible. Sometimes they mix herbs and end up with the product that has nothing. no activity. And that's why in some studies they get no effect, because they're using the wrong part of the plant, or they're using something that doesn't have the active phytochemical in it. An analysis of 29 trials involving over 5,000 patients have shown that St. John's wort was superior to placebo in patients with major depression and was similarly effective as standard antidepressants. So you would ask, why would you ever want to risk an antidepressant with all of the side effects when this is available? Okay, and then we have ginkgo biloba, which is commonly used for confusion in older people, increasing dementia and memory deficit. This pictured here, the leaves, maidenhair tree from China from many, many thousand years. It's a very old, they almost call it the fossil tree. Results from use of ginkgo have shown inconsistent results for cognition, mood, depression, with no difference from placebo. There are other studies which were small and not well controlled that did show some benefit. So the benefit here is questionable. Patients with Alzheimer's disease showed no consistent pattern for any benefit associated with ginkgo. The clinically significant benefit of ginkgo for people with dementia and cognitive impairment is unreliable and inconsistent. So we would put this on the list of don't get too excited about. Now, many people, particularly women, during certain times of the month, and they want they feel bloated, they want to get rid of fluid, they often resort to a simple, soft diuretic, which could contain any one or all of these products that are known to have mild diuretic effect. Goldenrod, which grows in the late summer, early fall, about yay high, nice bright yellow flowers. The juniper berries from the juniper tree, parsley, Uva ursi, which we see pictured here, and then the leaves of stinging nettle. These are the common ones, although dandelion is also could be added to this. Now, some fairly new data relates to hibiscus. This is quite exciting to me because hibiscus is commonly added to a herbal tea. And you can see the date on this from the scientific data at the bottom. It looks fairly recent, doesn't it? 2013, I think I remember when that was. Infusions of the calyx or the leaves are used in at least 10 countries worldwide to treat hypertension with no side effects. Now, the interesting thing is in randomized controlled trials where the hibiscus extracts have been given, they found significantly lowered both systolic and diastolic blood pressure in adults with pre to moderate essential hypertension and type 2 diabetes. The hibiscus tea was as effective at lowering blood pressure as the medication captopril, less effective than lisinopril. Total cholesterol, LDL and triglycerides were lowered in the majority of normal lipidemic, hyperlipidemic and diabetic animal models. So what is all this saying? This is saying that taking 2 or 3 cups of hibiscus tea every day can help those with marginal or minor hypertension to actually lower their blood pressure. Over 1/2 of the randomized controlled trials showed daily consumption of hibiscus tea or extracts had favourable influence also on lipid profiles. And the key seems to be the red pigments in the hibiscus flowers, which are called anthocyanins. These are found in great abundance, and these are known to have anti-hypertensive and hypercholesteremic effects. Okay, and here is the study that was published back in 2010, looking at the systolic and diastolic for all of the 65 pre and mildly hypertensive adults, 30 to 70 years of age, and they were given 3 cups, 240 mils or 1 cup, so that's 3 cups of hibiscus tea for 6 weeks. And this is the reduction in blood pressure. 7 points, the diastolic 3 points. The placebo, minimal to nothing, okay? Interestingly, when they looked at those with the very highest blood pressure, they had even more significant, twice as much reduction in blood pressure, both systolic and diastolic. This is the people with the highest blood pressure, and this is all 65 people. So this is a subgroup of this. Cranberry used to be thought that because they were so acid, that helped with urinary tract infections or UTIs. But they have now shown that particularly elderly women who drink not cranberry cocktail, but cranberry juice. The cocktail is mostly sugar, but cranberry juice that can reduce by up to a half the likelihood of developing and overcoming the infection. The exciting thing about it is, in the next picture, this shows you the fimbriae on the E. coli, which inhabits your urinary tract. You see these are like Velcro that hook on to the urinary tract and multiply. Okay, once they live there, they can multiply. But this picture here shows you what happens when you take cranberry. The red pigment in the cranberry is like plasticine or clay, or I don't know what word you have here, but it adds onto these hair-like projections so that it prevents it from hooking. It's like putting clay between the Velcro, and so the Velcro doesn't clip together, and these don't inhabit your urinary tract, and so since they don't colonize, the infection cannot continue. And then we have medications for prostate. The BPH we call benign prostate hypertrophy, or men as they get older their prostate enlarges. These are the typical sort of medications that are recommended. Your saw palmetto, stinging nettle, the root. Remember the leaves were for diuretic. You don't want to eat the leaves raw, of course, you get all the prickles, but you cook them and the prickles go away, but here it's the root. The African prune tree, which is quite hard to get, Pygium africanum, pumpkin seeds, and beta-sitosterol, which is a plant sterol. So let's take a look at these. I think there's a lot of interest today with men using medications that don't cause loss of other functions. Okay, beta-sitosterol was the last one we mentioned. This is in the Cochrane Review. In 4 studies, Britain and Germany, almost 500 men took this level of 60 to 195 milligrams per day of beta-sitosterol for up to 6 months. They had a greater urine flow than those men who took a placebo, milder symptoms, and they got up 1 time less per night. The problem were these studies were small and short-term, and they tested many different types of formulation. Okay, and someone might ask, so where do we get beta-sitosterol? Well, you buy it from a bottle, but then you can eat it from food. Okay, and you see what type of foods do you find the beta-sitosterol is largely in? Seeds and nuts, exactly. Okay, pistachios, sunflower seeds, pumpkin seeds, all of these. Okay, now what about Pygium africanum? 18 different trials lasting for up to 4 months were analysed. Compared to placebo, the Pygium africanum provided a moderately large improvement in symptoms and flow measures. Men using this medication were 2 times more likely to report improvement in overall symptoms. Getting up in the night to urinate was reduced 20%, residual urine volume reduced 24%, peak urine flow increased 23%, okay? All quite useful, beneficial results. And what about saw palmetto? This is the most common, the most popular one, and here, while the initial studies look good, the more recent comprehensive studies are not good. There didn't seem to be any benefit. Now you might say, but I know somebody who gets benefit from it. Well, we'll come back to that issue in a little bit. There are some people who know that tomatoes are good for protection against prostate cancer. Anybody heard of that? Yeah, most of you have heard of that. Because the pigment, lycopene, in the tomato, in guava, in red grapefruit, in watermelon, it's the same pigment, it can accumulate in the prostate tissue, and it's a very powerful antioxidant. So people have often suggested, well, maybe this is also good for swollen prostate. And trials, you see trials in USA, Germany and India on a number of men who took up to 30 milligrams a day of lycopene for almost a year. Prostate symptoms were no fewer than with placebo. In other words, no good. Lycopene, nothing. Okay, so if you want to buy this or you hear people using this, this report will document there's no clinical evidence that it works. Okay, now what about women's problems? There are a number of herbs that women use for their menstruation or menopause or other issues. Black cohosh, chase tree berries, which this is the chase tree here. Red clover, which is very common in Australia and other parts of the world. And then evening primrose oil, this plant that comes out in the evening, flowers, and they shut up in the morning. The seeds are very rich in gamma linolenic acid. So what is the data regarding these? Black cohosh roots recommended by German Commission E, which is, as you know, the standard for analysing and recommending various herbal products. They recommend it as a treatment for premenstrual discomfort, painful menstruation, and menstrual symptoms such as hot flashes, night sweats, vaginal dryness, and psychological symptoms. Okay, so that's the recommendation. What do the clinical trials show? The clinical trials that last up to 6 months, taking up to 148 milligrams a day, have demonstrated positive results for menopausal complaints. It's good news. 16 randomized controlled trials involving over 2,000 perimenopausal and postmenopausal women taking black cohosh for up to 6 months. In this case, they found no significant difference in the frequency of hot flashes or in other menopausal symptoms. Okay, so we have a question as to its total validity. It works for some things, it may not work for other things. It may depend on the product, how well it's extracted. This remifemin is the most common. The Germans are the world leaders in doing clinical trials in herbal products, and sometimes products in other parts of the world, such as America, they don't get the same benefit unless they import from Germany the product from which the original trials were done. And some of the researchers in America don't always take this into account and start to publish, this doesn't work, this doesn't work. Well, it doesn't work if it doesn't have the active component, obviously. Red clover is used also for cardiovascular health, and 109 postmenopausal women were assigned to randomly receive either 2 daily capsules of red clover isoflavones for 90 days or placebo. daily hot flashes and frequency of night sweats and overall intensity of menopausal symptoms significantly decreased by about 75%. Okay? No side effects were seen. This is always encouraging, isn't it? To find that there's no side effects. What about evening primrose oil? This has also been used to treat skin problems as well as rheumatoid arthritis, as well as ladies' problems. And as I mentioned, it has this very nice compound, gamma-linolenic acid, which bypasses one of the fatty acid metabolic stream pathway and is useful in terms of producing active eicosanoids. 16 out of 22 studies have demonstrated positive effects for PMS, skin problems, and also diabetic neuropathy and arthritis. But these are small trials, and usually they say we need more studies to verify and validate this. There are some herbs that are useful for immune function. We listed here 2 of them. Let me just explain echinacea. As you probably may know, echinacea, there are 3 different varieties. There's echinacea purpurea. This has the very bright, stubby petals. Echinacea pallida, these are pale flower leaves. And then you have the angustifolia, which have the long, thin. So all 3 of these can be used. They have slightly different activities. Usually it's the flower tops or the leaves at the top as well as the roots that are used. And many clinical trials have demonstrated positive effect for upper respiratory tract infections, and the treatment is most beneficial if started as soon as possible after the symptoms begin. What about golden seal? Okay, people often use golden seal along with echinacea, and here the story is not good. In spite of people swearing that golden seal cured them of their cold and is wonderful, this, and this, there's no data whatsoever that it helps with colds or flu. No trial has been able to show the effectiveness of golden seal. Okay, garlic, we've already mentioned, it's useful for cardiovascular and cancer, but it's also useful, has been used for coughs, colds, catarrh, your phlegm, your runny nose, runny eyes, all of this. Clinical trials, however, do not support such use. I know a lot of you are going to question that because most of you in this room will say that garlic will cure me of my cold or will prevent me from getting the cold. Well, in terms of these symptoms, there's no evidence to show that it helps with the symptoms. It does have immune function, it does increase phagocytosis and natural killer cell activity, antibody production, lymphocyte counts, so it does protect our immune system. But in terms of reducing the symptoms of colds, there's no data to support that. It does have antibacterial effect, particularly against H. pylori, which we know is associated with ulcers of the stomach. It also acts against salmonella and staph and strep, clostridium, and it also works against candida, which is involved with vaginal infections and athlete's foot and so forth. We've already mentioned about the herbal products for diabetes. This is just a picture to remind you of the last lecture we did. And again, this is just to remind you of what we talked about. This family, this allium genus, leeks and garlic, onions, chives, shallots, these all belong to the same group, and these protect us against blood clots and elevated blood lipids and cancer. And just a little bit of word about some culinary herbs and how they have some very mild but perhaps important things. We have coriander, or here, I don't know, I think in Britain cilantro is the leaves and coriander is the seed. Is that how you describe it? No? Okay, well, we do in Australia. I thought we copied from Britain, but anyway, coriander is useful for mild digestive problems. Cumin stimulates the appetite and also has mild blood glucose lowering effect. Makes awesome falafels, right? Cumin is also used for making hummus, right? You all know hummus. We use these cumin seeds ground up. Parsley, also we mentioned earlier, its mild diuretic effect also helps stabilize the GI. Sage is often used in gargles and mouthwash because of its antiseptic property, anti-inflammatory, used to treat inflamed throat and mouth. And then thyme, which also is used for upper respiratory tract infections. Now, I want to conclude this hour by asking what may seem to some of you a stupid question. Do herbs really work? Or do they work by the placebo effect? Okay? One thing we know in medicine is that placebos have a very powerful effect. It's estimated, as mentioned here, that 30 to 40% of subjects who take a placebo get a beneficial effect. The effect of the placebo is to duplicate. It's a fake, but it's to duplicate the effect of the real medicine. And there's a lot of data to show that placebos have been useful to improve or to cause the remission of diabetes, heart disease, cancer, headaches, pains, and ulcers. The word placebo comes from the Latin word meaning I shall please. We go to the doctor, patients go to the doctor. The doctor doesn't know what to do for them, so what do? I will please. They give a placebo. They give some dummy, some fake, some pill that doesn't have any effect. What effect does it have on the person's sickness, on the person's illness? In 1 out of 3 cases, it cures the person. Okay? This is well documented, well known. It's what we think about the medication that's often very important. The placebo can have both a physiological and a psychological effect caused by either the individual or the substance or the procedure or whatever. Having faith in the therapist or in the substance and an expectation of a successful outcome is essential for the placebo to provide healing. Okay, keep that in mind. Norm Cousins once said that there is an infinite capacity of the human mind for self-deception. And the greater a person anticipates relief, the more effective will be the placebo, which may not have any effect if you just analyze it from what it contains. So when a patient goes for therapy, where they go is often very important. If they go to another country, it's more likely to work. If they go to an exotic place, a spa, it's more likely to work. If you have a better living centre in the country, guess what? They get them away from their rush and hubbub and congestion of the city. They go out in a relaxing place in the country. It's going to be more effective in working. If it comes from the Amazon or goji berries from Himalayas, it's going to be very effective, okay? If it's expensive and large and colourful, it's going to be more effective than if it's small and white, okay, and cheap. Something that smells and tastes pleasing is going to be more effective. A new idea or a new method is going to have appeal. If you go, somebody comes to your Better Living Centre and you're doing what everybody else is doing, it's going to be less effective than if you give them something that they have never heard of before. It's new. There's something new, okay? And one person has said, we should use new remedies quickly while they are still efficacious. There's nothing like a new book to capture my attention. When it sits on my shelf for a year and I haven't read it and I go to read it, it's not so interesting as when I first bought it. Newness has a real appeal, a real attraction. The belief and enthusiasm of the health giver, the charisma of the person presenting the program is going to have a big effect upon how well your centre is working. How the receptionist and how the nurse practitioner treats the person waiting in the office or in the reception room is going to have a vast impact on the treatment or the herb or the medication that you give. Don't laugh at this. This is all well documented in the literature in terms of how people respond to things. And of course, we've already mentioned belief in the effectiveness. So if you go to a centre which is warm and friendly and interested in your life and is enthusiastic and have great belief in the power of turmeric or whatever, just picking on something, and they're out in the country, the effect that this is going to have on the person is far greater than in the city doing what seems to be similar, non-new, uninteresting sort of thing. It's not going to work. Okay? Now, is this something that is recognised? Well, it's reported that people who thought they had glucose intolerance stopped taking gluten. And guess what happened? The symptoms all went away. I had a gluten problem. Took away gluten, all the problems went away. All the symptoms disappeared. But after 2 or 3 months, the things started to come back. When they were tested, they had no glucose intolerance. See? This is the power of the mind. And I give this 10-minute little talk for a reason. There are many people who question the power of herbs, who doubt the power of herbs. Will herbs work for them? Herbs don't work for everybody, even though there is documentation for many of the things we've talked about, shows your effect on cholesterol, blood clotting, blood glucose, many things. But you have to believe these things work for them to have the full potency of their operation. Mrs. White says in Ministry of Healing, the power of the will is not valued as it should be. Let the will be kept awake and rightly directed, and it will impart energy to the whole being and will be a wonderful aid into the maintenance of health. Now, don't get me wrong. I'm not saying that herbs are just a bunch of wish-washy, hocus-pocus, mumbo-jumbo, whatever. And it's only psychiatric people who take these and who psych themselves into believing that this is going to work and it will work. No, I'm not saying that. What I'm saying is that for some people, who take a herb, even though there is no clinical documented basis for it to work, it could very much be very effective. And if we are to laugh or to scoff or to poke fun at them, what is the purpose? If they are getting benefit from a very small outlay of cash and they are feeling better, isn't this what we want them to enjoy? Anybody responding? I'm talking to the walls. Okay. You didn't get the idea? Okay, the idea is that sometimes, even though there is no benefit, documented benefit for a herb, but somebody who picks this from the field or buys it from the marketplace believing that it will do them some good, there is a very high chance that it will do them good and will cure their problem. Even if it doesn't cure the problem, the symptoms have disappeared and they are getting relief and joy from being symptom-free. And is this valuable experience to have? I would say yes. So when people come to me and say to me, I'm taking this, what do you think of it? And I know in my heart that there's no evidence for it, I'm not going to look to them and say, oh, this is stupid. There's no benefit to this. You say, I'm happy for you that you are taking this. This is fine. I hope that I have made my point, that I am not denigrating the use of herbs, but recognizing that the effect, the placebo effect, is real. It's recognized by the scientific community. They use it for standard medications, and if we use it for herbal medications, great. Okay, so just wrapping it all up now, if you're worried about where you can get herbs that are safe, you buy them from boxes from well-known companies. You don't buy them loose from Aunt Jemima or Uncle Billy or something else. We don't know whether they know what the product is, and there are lookalikes, just like there are lookalike mushrooms. People harvest mushrooms and they die because they think they're getting such and such and they're getting a poisonous one. Don't exceed the recommended doses. If the label says 2 tablets a day, don't take 4 because you want it to have twice the effect. No. The company usually puts the maximum amount recommended there, so don't go beyond that. You want to have something that's standardized. I already told you before, how do we know that something is standardized? You look for the phytochemical that's the active compound in the herb, and it should be listed on the label. It should say, for St. John's wort, it should say this is guaranteed to contain so much hypericin, the garlic so much allicin, valerian so much valerianic acid or something like this. Okay, it'll list it. If it doesn't say this, use a different brand. If the brand is not working, change the brand. In the United States, the ones that we use that are commonly imported from Germany are Nature's Way and Farmerton. I don't know what you have here, but find out the brands which are reliable. So when it comes to culinary herbs, you can grow your own, even in the winter, even in northern England. You can put these on the window shelf and you can grow, okay? These, of course, are available, but remember, these lose their potency after some time, so don't keep them for years and years and years. Throw them away and get some new ones. You can grow in all kinds of spaces. Here's the window ledge, a back corner, a wheelbarrow, the back steps. Nobody can say, I don't have any space, even if you're living in a one-room condominium. There's always a window ledge, always a doorway somewhere where you can grow chives or sage or something that you can use. So, in summary of this hour that we've presented here, what can we say? A variety of commonly used herbs may be useful for the treatment of various conditions or illness. We're not talking about major reversals so that you no longer have to have heart bypass surgery or something like this. But there are spices we saw in the last lecture that can lower blood cholesterol, lower blood clots, that can help in certain ways, can promote against cancer, can help blood sugar. We've also seen in this second lecture there are some medicinal herbs that can help with managing menopause, managing the prostate, managing headaches. Okay, these things are simple treatments that don't cost a lot of money and that can be readily shared. This is the exciting and important thing that we look at here, is that many of our neighbours and friends, they don't know all this information. And this is a way to bridge, to develop friendship with people. Oh, have you tried feverfew for your migraines? Oh, and they try it, and what happens? Do they become your friend or not? Of course they do. And you tell them some other things, some more things that are beneficial. And after a while they say, this person is interested in my well-being. And then they are more interested to hear about Jesus, right? And this is a bridge to be able to, through friendship and sharing health message. So I think, as a summary from the last two lectures, I like this text from Psalm 66 verse 5. See what God has done. How awesome are his works in man's behalf. And in another lecture, we could talk about the phytochemicals in food, in grapes, in broccoli, in tomato, in whole grains, in many different things. It's similar phytochemicals, and these things not only provide nutrients, they also protect us against diabetes and heart disease and cancer. And so to that we can also say the same thing. Man, how awesome is God's creation. We don't see all the value of these things.